So hi, we're back. This is our fourth and fifth period class, and it's a block, and we have about 25 kids in here. And so, Sherry, I'll let you guys all introduce yourselves, but I'll turn the monitor to the class.
Excellent. Hi, guys. So you guys met me before. I'm Sherry from LifePlan, and I am excited to introduce to you two of our nurses, Kathy Wellin and Kristin Ross. And that's all I'm going to say. I am going to turn it over completely to them, and they are going to talk to you today about the interesting topic of STIs and STDs. Kathy, go ahead.
Okay, thanks, Sherry. Well, as your teacher said, my name is Kathy Wellin, and I'm the nurse director at LifePlan in Niles and Benton Harbor. And Kristin Ross is an RN with us today, and she is on our medical team in Benton Harbor. So she's going to be sharing a little bit of information with you down the road. I know Sherry's been talking to you a lot about LifePlan recently, and hopefully I won't be repeating her, but we're a little bit different as we're coming from the medical side. And today, as Sherry said, we're going to be focusing on STDs and STIs. And one thing I wanted to explain before we get into our talk is the terminology. I'm sure probably you have heard of the term STI or STD, and it can be a little confusing about what is the difference between the two of those. So STI stands for sexually transmitted infection, whereas STD stands for sexually transmitted disease. So an infection is the first step on the path to getting a disease. So the word disease infers that a person has a medical issue with signs and symptoms, whereas with an infection like chlamydia or gonorrhea, there's often no signs or symptoms. STDs start with an STI, but not all STIs develop into STDs. And since STIs can be asymptomatic, you're not always aware that you have a sexually transmitted infection. Oftentimes you don't have symptoms. And that's one of the reasons why it's important to be tested if someone is sexually active. That being said, it takes some time for an infection to develop, for the antibodies to be able to be read on a test. So, for example, if a person had sex on a Friday and they were fearful the next day, oh no, what if I get a sexually transmitted infection? If they went to get tested on Monday, they might get an inaccurate reading because they have not had enough time to develop those antibodies. So the best thing to do when there is uncertainty about whether there is an infection or not, it's best to go to get medical advice from, say, a place like LifePlan, where we can help you know whether you need a test or whether you need to wait a little bit. But it's always best to check with medical providers when you have doubt. I think one thing that I wanted to emphasize for you all as we talk about STIs and STDs and the treatment and how LifePlan can help with that, I want you to know that we are a holistic medical clinic. And that means that we're not only concerned with the physical treatment and aspects of STIs and STDs, but we're also concerned with people's emotional and spiritual health. Sexual health is a little bit different than just treating someone for, say, a sore throat, because with a STI, our patients have relationships with other people, and that just throws in another level of helping people in what they're dealing with. So That being said, we need to be really good listeners at LifePlan when our patients come in to talk to us about their health issues, because it's not always just about physical things. There's also emotional and spiritual aspects that we want to speak into their lives. I was trying to think of the best way to explain to you the spiritual or emotional side of healthy sexuality. And the best way, I think, is to mention that all of us have a conscience. And I'm not sure if you know what that is, but so I just thought I'd look that up in the dictionary and give you that definition. The definition of a conscience is an inner feeling viewed as a guide to the rightness and wrongness of one's behavior. And I don't know how many of you have watched the movie Toy Story 4, but as I was preparing for this talk to you guys, I happened to watch that. And there was a part in there where Woody is explaining to Buzz how he knows what is right or wrong for him based on the inner voice. And unfortunately, my analogy for the conscience breaks down because Buzz thinks his conscience is that little voice where he pushes that button on his chest and it starts telling him things. So I hope my explanation is a little more helpful to you as you think about sexual health. And one of the things with that and spirituality is each of us is born with a conscience, but everybody's conscience is different based on their upbringing, their experiences, their culture. You know, when you're making a decision for your health, especially in the area of sexuality, it's really helpful to consider ahead of time what's right and wrong for you when making decisions about having sex, when you're going to make that decision. It's better to think it through ahead of time rather than being spur of the moment in a situation where you're making a decision based on emotions or based on friends around you. A lot of times people will influence you, and yet they have a different conscience than you. So it's really, we feel like it's really helpful to think through those decisions prior to being in the midst of those just emotional times. One of the things I think, you know, with a decision about regarding sexuality, there's a lot of consequences, positive, negative, that are involved in that. And you want to make the best decision so that you can have the best health outcome from that decision. And one of the things that I thought to just help you guys start thinking about that, because actually we're just here to give you information. We're not here to tell you what to do one way or the other. We just want to give you the best information so that you can start thinking about these things before you're in that situation. Here's a scenario that I thought might be helpful as you think about this. And I'm just gonna tell a little story and use the name Lee. And so just say that Lee goes to a party and they're serving alcohol. So Lee decides to drink. And as we know, alcohol can impair our decision making. And Lee ends up having sex with someone at the party. Well, the next day when Lee wakes up, Lee starts having regrets about what happened the night before, and then begins thinking, oh no, what if I have an STI? So that's when the anxiety starts. And then Lee starts thinking, what if I have to tell my parents because I need to go to the doctor and find out if I'm okay? And as you know, at that point, all this emotional turmoil that might have been avoided had Lee put more thought into the possibility of choices that were gonna happen, you know, in that kind of a scenario. And I think of thinking through a plan for sexual health can be like having, you know, a plan if you have a fire or, you know, a fire drill, so that you have a well thought out way of escape prior to being in that emotional, you know, emotional setting. You can take the time to think through calmly and logically what you really want to do and what are the possible consequences and how you would deal with those. It's so much better to think through it, you know, ahead of time rather than looking back and having regrets. And one of the things I just want to mention is that LifePlan is a great place to find help for working through that kind of a plan ahead of time. We actually do STI testing, STD testing. We also do pregnancy testing, and we do ultrasounds, and all of our services are free. And a lot of times as a nurse, I will have a young mom come in and, you know, she's pregnant. She wasn't expecting to be pregnant. She's got a lot going on in her mind and in her heart. And it's really hard to watch that. And so at LifePlan, we want to help young people figure out their life plan, hence the name, prior to having to come in with all that emotional turmoil. And that's one of the reasons why we chose the name LifePlan. We believe that there's a plan for everyone's life, and that there's a good plan, and we want to help you find it, and we want to help you walk through it. And one part of our mission statement is helping people choose life and live a hope-filled life. And sometimes when we make choices as human beings, which we don't always make the best choices, we can lose hope. We can think, oh, I blew it. I'm so discouraged. Why did I do that? What am I going to do? I'm a failure. Well, LifePlan is the perfect place to come if you have any of those thoughts. Again, we want to give people hope. And I can just tell you, I've had so many young moms come in, and we've been able to help them work through all their emotions and get back on track to walking in that good life plan and giving them restored hope. So that being said, we're here for our community on both sides, whether there's wanting to make a plan prior to coming into situations, or if you've made some situations and you need help with that. We are so glad to be able to help you with that. Now I'm going to turn things over to Kristin, and she's going to give you some information about specific STIs. And guys, we just want you to know that this is a lot of information. It's a lot of medical information, and we're not here to overwhelm you, and our goal is not to put fear in your heart, like, oh no, if I have I'm going to get some awful disease.
Yeah.
We want to give you this information. Our heart is to help you. We're not trying to put fear in you. So just know that that is our heart in this.
All right, sounds good. First, can you see my screen? Can everyone see my screen? Or do I need to reshare it here?
Yeah, I think you need to reshare.
All right, this happened last time. And share screen. How about now? Can you see it now?
Yeah.
All right, good deal.
Well, no, we still see LifePlan. Is that what's supposed to be?
Yes.
Okay.
Yep. Yeah, that's the one. Just not my face. Okay. Thank you. So I know all of you guys woke up so excited that you got to talk today about sexually transmitted infections. This is what you've been waiting for weeks, but it is important because it is a bit of a pandemic that's going on in the United States. The Centers for Disease Control and Prevention, the CDC, estimates that there are approximately 20 million new STI or sexually transmitted infections each year. So that's, and almost half of those are ages 15 through 24. So you guys fall into that category there. And a couple of these, if you look at the screen there, you see 1.8 million cases of chlamydia in the US. There's 583,000 cases of gonorrhea, 115,000 cases of syphilis, and then 1,300 cases of syphilis among newborns. So it's running rampant, and left untreated, STIs can lead to serious long-term health consequences. So if you're sexually active, getting tested regularly should be an important part of your sexual health and overall wellness. We're going to talk about chlamydia, gonorrhea, and HPV. Let's start with chlamydia, and we're going to be going over symptoms, transmission, risk factors, prevention, and treatment. So chlamydia is a common sexually transmitted infection caused by bacteria. You might not even know you have it because many people don't have signs or symptoms in the early stages. And it's not difficult to treat, but if left untreated, it can lead to more serious health problems. So the early stage symptoms, you might have painful urination, vaginal discharge, discharge from the penis, painful sexual intercourse, bleeding between periods, and testicular pain. But later stage, if you leave it and don't get it treated, it can lead to complications like infertility, infections in newborns, and ectopic pregnancy. It's most commonly transmitted through vaginal, oral, and anal sex. And it's also possible for pregnant women to spread chlamydia, like we said, to their children during delivery, which can cause pneumonia or other serious eye infections in the newborns. Risk factors are being sexually active before age 25, having multiple sex partners, not using a condom correctly or consistently, and having a history of sexually transmitted infections. But there is a way that you can prevent it. The best way to prevent chlamydia is to abstain from sexual activities, to use condoms correctly when you do, and to limit your sex partners and get regular screening. So the CDC themselves say that there is no 100% effective way to avoid sexually transmitted infections besides abstinence. So waiting and having one consistent partner your entire life. Those are the only consistent ways that you can prevent contracting a sexually transmitted infection. And then, like I said, it's easily treated with antibiotics. Then we've got gonorrhea. So gonorrhea is pretty similar to chlamydia. It's another STI that's caused by bacteria. And this one often affects the urethra, rectum, or throat. So similar in that it has little or no symptoms early on. They may be vague, mild symptoms, but some of those will include painful urination again. You may have pus, like drainage from the penis, vagina, rectum, or eyes. You may experience abdominal or pelvic pain, pain or swelling in one testicle. And then if left untreated, more serious complications include, again, infertility for both men and women, and increased risk of HIV and AIDS. And then also complications in babies as well. This one is transmitted via vaginal, oral, or anal sex, but can also be transmitted to babies during birth. And then risk factors for this one, like I said, it's pretty similar to chlamydia. Women who are younger than 25 and men who have sex with other men. And then a couple other risk factors include having sex with multiple people or having sex with someone who has had more than one partner. Those are going to put you at risk for contracting these infections. And then prevention, the best prevention is abstinence, like I said, and then also having one monogamous relationship, meaning both of you are your sole partner for life. And this is what the CDC recommends. I think that's all I want to say about that. And then treatment, again, for gonorrhea is antibiotics because it is a bacterial infection. Now, HPV is different in that this one is caused by a viral infection. that commonly causes skin or mucous membrane growths or warts. So there are more than 100 varieties of HPV, and some types of HPV infection cause the warts all over your body, and some can actually develop into cancer. So the symptoms would be the warts, and you can see these on your face, your hands, feet, genitals, or around the anus. And you may actually develop oral and upper respiratory lesions on your tongue, tonsils, or nose. So this one's not as fun as the others. None of them are fun, but this one you definitely don't want to get. And these infections are often transmitted sexually or through other skin-to-skin contact. So risk factors would be having an open spot or a cut in your skin. And the more sexual partners one has, the more likely they are to contract this virus, especially if any of their partners have multiple sex partners. And then obviously you're not going to want to touch someone's warts because that's going to increase your risk of becoming infected yourself. And then prevention. So this one, it's caused by a virus. So this has a vaccine that can help to protect against it, but that's only certain strains of HPV that it protects against. It's also recommended that women ages 21 to 29 get a pap test every 3 years. And you can, again, decrease your risk by being with one person your entire life and abstaining from sex. And one thing that's interesting that may make you not want to walk barefoot in the YMCA anymore is you can prevent this by wearing shoes in public pools and locker rooms. So next time you go barefoot in the locker room, just kind of think about that. And then treatment. So the warts often go away without treatment. However, there is no cure for this virus. So they can keep coming back as flare-ups. There are medications that can be used to eliminate the warts though, if needed. And if you ever have an abnormal pap test, your doctor will order samples or biopsies to be taken of your cervix to check for cancer. And then any cancerous lesions would need to be removed.
So Kristin, can I ask a question?
Yeah, definitely.
Okay, so you're saying that the strain, the warts, the strain of that can be passed on from not wearing any shoes in a locker room, or specifically that strain or any strain?
So I'm not sure on the specific strain, but I believe it's all of them. I don't want to tell you, but I'll look that up while Kathy's talking. Okay. But it would have to be someone that has HPV that's going around barefoot in the locker room, and you have, say, a cut or some open skin on your foot, and so you come in contact with that.
Yeah, it's got to get in the bloodstream.
Right. Which
Is
pretty but yeah, let me look that up if it's a specific strain or all of HPV that can be transmitted that
and
way.
People can have warts on their hands, because I had a student first block after class to ask me outside. People have warts on their hands or different body parts. They have nothing to do with HPV.
Yes.
Okay.
So don't go around assuming everyone with warts on their face or hands has HPV, because that's not the case. There are different causes for it, but yeah, that is one of the symptoms.
Correct. Okay. And the same thing when we talk about herpes, the same thing. You can have a cold sores and not have it be transmitted, because that'd be herpes simplex 1. That doesn't mean that was sexually transmitted.
Right. Yeah. There's a difference between genital herpes and the one that you get a cold sore in your mouth for. So that's correct.
But they can still you can still pass both on.
Right.
Okay, guys. Okay, thank you. Sorry.
No worries. So Kathy is actually going to talk next on HSV and then HIV. So go ahead and take it away, Kathy.
Okay, thank you so much. Okay, so HSV is herpes simplex virus, and this is another virus, and there's herpes 1 and herpes 2, and 1 is commonly known as cold sores, and herpes 2 is the genital herpes, and 1 in 6 people between the ages of 14 and 49 have genital herpes. So it's common. the symptoms we find with this virus are painful sores around the genitals, anus or mouth, swollen lymph glands, a genital discharge, and fatigue and body aches. And the transmission is oral, vaginal, or anal sex or mutual masturbation. So that would be skin-to-skin contact. The risk factors with this virus, one of them is that women get this more easily than men. And another risk factor is having multiple sex partners. So the prevention for herpes, genital herpes, is to avoid sexual contact, and also the perfect use of a condom. Every time you use it, using it 100% correctly. That being said, the CDC even says that that is not a good way to prevent from getting herpes, because a lot of times with these sexually transmitted infections, there's other risk factors involved with the people who are coming in contact with these STIs, that being use of drugs and alcohol. So that kind of causes problems with using condoms when people aren't exactly, when they're on drugs or using alcohol. So they say that, you know, condoms can help, but they're not going to prevent it. The treatment for herpes is, well, one of the things, since herpes is a virus, once you are infected, there's no cure. The blisters or sores caused by the herpes virus usually heal over 2 to 4 weeks. And there are some medications that can help. There's medications that can be taken to reduce the severity of the outbreak. So it will lessen the time that you have the actual cold or herpes sores. And then also there are medications that a person can take daily that are antiviral medications, and they can prevent the spread of herpes, but they have to be taken every day, and that has to be done, you know, responsibly. A lot of times people get on these medications that they need to take every day, and it's really hard to take it at the same time and every day. So the next STI we're going to talk about is HIV, and that is human immunodeficiency virus. And as most of you probably know, that this can lead to AIDS, which is acquired immunodeficiency syndrome. And so one of the things about AIDS or HIV is that it also is, once a person gets this virus, they're going to have it for life. And as it interferes with the immunity of a person's body, gradually over time, it can cause the person to contract AIDS. So the symptoms of HIV are episodes of tiredness, fever, body aches, swollen lymph nodes, and also rare cancers or infections that your body cannot fight effectively. The transmission for HIV is sexual contact, also blood and body fluids, contact with those. And just so you know, not saliva, it's just blood and body fluids. Also sharing of needles and other drug equipment. And so therefore the risk factors are sexual contact and needle sharing during injection of drug use. And again, the CDC says the prevention of HIV is through abstinence and also never sharing needles. And the treatment for HIV, this is just most recently, they've come up with treatment, as there's no cure, but there are meds that we can use to control the infection and prevent the complications. And the one is called PEP, and that's pre-exposure prophylaxis. And that would be given to people who are going to be frequently exposed to HIV, maybe somebody who knows they're a drug user and they know that they're going to be in situations where they're going to come in contact with HIV. They're able to take this medicine every day. Again, it's one of those everyday medications that you have to be faithful in taking or it's not going to help. So that's called PEP. And then the other is, that's called PrEP, excuse me. The pre one is called PrEP. The other one is called PEP. It's a little confusing. And that's PEP, and that stands for post-exposure prophylaxis. And that medication is for somebody who has been recently exposed to HIV, possibly someone who has had a sexual assault. And so if they go to the emergency room within 72 hours of that assault, they can be given this PEP, and they take it for 28 days, and that they are able to hopefully avoid the HIV infection. So that, I think that covers everything for HIV. And so I'm going to turn this over for Kristin to share a little bit more information. And then when she's done, we're going to give you guys an opportunity to ask questions.
Oh, 1 second. The TV for my son paused, so I'm just going to restart it. If you want to talk about, hold on, or I'll just have him join me for a second here.
You're fine, Kristin.
What's
whatever.
better, Kathy? All right. Hold on, buddy. Let me go start it. It'll take 2 seconds.
We're good.
I love it.
I know somebody said with these Zoom calls, just meeting the family, I was afraid Amazon might come to my door because my dog will have a fit.
Yeah. Well, that was quick.
Sorry about that, guys.
Oh,
This is why you want to be ready when you have kids. Okay, so we talked about prevention for each of the sexually transmitted infections kind of while we were going through it. But if you are in general to avoid sexually transmitted diseases and infections, there are some steps that you can take. So the first is to limit your partners. And we have a pamphlet that we borrowed from the Centers for Disease Control, the CDC, that we go over with each of the moms and clients and teens that come into our clinic. And it just shows your risk of contracting infections and sexually transmitted diseases, the more partners that you are with. And who you're actually exposed to when you have sex with someone. So if you have sex with one person, you're only exposed to that one person. But if you have sex with 2 people, then you are potentially exposed to 3. And with 3 people, then it's 5. And so it keeps going up and up until if you have been with 12 people, you've actually been exposed to over 4,000 people. So that's kind of gross in that, like, how many sexually transmitted infections, your potential for contracting these diseases skyrockets when you've been exposed to over 4,000 people. So we just want to be careful what we're doing. The second thing you can do to protect yourself is to get tested regularly, and then also to talk to your future partner about his or her history and make sure that he or her is getting tested also. Avoid drugs and alcohol, like Kathy said at the beginning, because even if you make the decision that you do want to wait, when you're under the influence of drugs or alcohol, you don't always know what you're doing. And so you may do something that you regret later in life. You also need to educate yourself and then to practice sexual integrity. So according to the CDC, I know we're sounding like we're on repeat, but abstinence from vaginal, anal, and oral intercourse is the only 100% effective way to prevent HIV. other STDs, and pregnancy. And the only way to have healthy sexuality is to have one partner for life. Those who choose to remain abstinent can avoid so many emotional and physical issues, including STIs and all the complications that come with those. My husband and I both made that personal decision when we were still in high school. We waited until marriage to have sex, and I'll tell you, never once have we ever regretted it. Waiting for a committed partner has led to greater health and stability in both of our lives. And so at LifePlan, we just want to encourage you to really think through your decisions when it comes to your sexual health. So now I'm going to open it up for questions for Kathy and I, and see if there's anything else that Kathy wants to add.
All right, guys. Questions about any of the STDs or an STD that you've heard of that they didn't go through? Any questions whatsoever? Transmission? Yeah.
No brave souls. Huh?
No, they're all, yeah, they're all pretty, I don't know if it's shy or it's just, you know, it's pretty self-explanatory to a certain extent, but
Yeah.
I think they're a little.
We can trust that we did really well at teaching.
Yeah.
I don't know, maybe, I think at times, I think maybe we should make up questions that we think. I definitely know if I was sitting there, I would not be asking questions either.
No, I know.
But here's the thing to remember though, you guys can feel free to contact us anytime at LifePlan. We are here for you, whether you are sexually active or not. We want to help you out, and you can contact us. You've got my email. I can get you in touch with Kathy or Kristin. We want to help you make the best choices, like they were saying. And just some encouragement for you too, that a lot of times you probably hear from people that everybody's having sex, all teens are having sex. That is not true. CDC data, and I found the actual thing here, says that nearly 70% of 15 through 17-year-olds are not sexually active, are not having sex. So it is not a thing of everybody's doing it. Most kids are not, and that is really the best choice to make.
Yeah.
I think the other thing I'd like to add is, you know, Kristin is more your guys' age. And, you know, thinking back on my own teenage years, I would not have wanted to go to my parents and ask them any questions about sexuality. You know, you can go to your friends, you can Google it, but I just think to know that there's someone who has been successful, that you could personally talk to and say, how did you do this? And, you know, what are the benefits that you're experiencing now? I just want to offer that Kristin is a resource that you guys could come to. She's closer to your age and she's had success in this area. So that's a big thing.
Yeah, definitely. And we dated for 5 years, and that was not easy. Like, that's a long time to be dating and to like remain abstinent. And so it's not easy, but it's very rewarding and it is doable. I think that's encouraging to hear that someone has had success in waiting.
Absolutely.
Definitely.